nurse. I live in Birchwood, Minnesota, the suburb north of St. Paul. I'm speaking to you today because I want to share my perspective on what cuts in this budget will do to the most vulnerable of Minnesotans. As healthcare providers, we know that health promotion and disease prevention is not only the most effective way to keep costs down, it's also the most humane. The facts are, providing patients and their family with access to primary health care services saves lives and saves money. It also protects human dignity and preserves our human rights. As a nurse, it's not hard to identify those patients who are poor, indigent, unemployed, people who have no health insurance, no primary care doctor. They don't get regular checkups. They don't get mammograms, colonoscopies. They're not screened for skin cancer. They don't go to dentists. They don't see an eye doctor. We see patients whose bodies are ravaged by years of living with undiagnosed and untreated chronic diseases such as diabetes, hypertension, heart disease, mental illness, and chemical dependency. These people come to our hospitals sicker and they stay longer. They come not only physically broken, but emotionally and financially. The proposed cuts to healthcare access services does not save you or the state of Minnesota money. This budget costs hundreds of millions of dollars in medical expenses that can be avoided with preventative health care and screening. Majority legislative members have told us that this budget is about cutting the cost and the size of government that has become bloated with the burden of caring for those who are not willing to care for themselves. They invoke images of people who want a free ride at the expense of hardworking, tax-paying Minnesotans. This is not the truth. The fact is, this budget is a political agenda. It's an attempt to dismantle our state government and our way of life in order to protect profits and the wealth of a privileged few Minnesotans. This budget is about protecting the wealthiest 2% of our population, folks earning over $300,000 a year who use their money and their access to unfairly influence our political process to their advantage. But what we know today is Minnesota has a reputation of being progressive. We have one of the most respected and thriving healthcare communities in the country. Our work ethic is a critical part of our recipe for success, but so is our history of social justice, human kindness, and inclusiveness. This budget fails miserably. It doesn't address the needs and desires of the vast majority of Minnesotans. It doesn't cut taxes, it doesn't improve schools, it doesn't fix bridges, it doesn't fix your street, it doesn't protect our environment. And it certainly does not provide adequate health care for the most vulnerable of Minnesotans. The only thing this budget does is it protects the bottom line of the wealthiest and most privileged Minnesotans. The top 2% of those whose taxes are tempered by unfair policies that enrich them at the expense of our most vulnerable citizens. We must unite to fight for our